I saw something interesting that it would be good to talk about real quick. The whole question of proton versus photon therapy, this time in oropharyngeal carcinoma. So here you can see how different forms of radiation deposit in tissue. Electrons are really good for treating lesions that are on the skin. Photons can reach a certain depth, but protons have this thing called a Bragg peak, which can be used for certain situations. As I like to say, the benefit of protons is they stop on a dime. The problem with protons is they stop on a dime. So this was a trial of 440 patients with oropharyngeal carcinoma who were randomized between photon therapy and proton therapy. The toxicity data was presented at ASCO 2024 and showed less need for feeding tubes in the patients who got protons. The survival data was presented at the PTCOG in 2025. And as you can see here, after about 3 years, the curves begin to separate. So that at 5 years, there's about a 9% increase in survival outcomes with the use of proton therapy. What's interesting is that the survival gain appears to be in the patients who had disease progression or recurrence. Is there certain situations would it be easier to salvage protons versus photons? And how the idea of this salvage therapy was being approached, and what factors were being utilized in determining the salvage therapy. There's a lot more to come on this, and I think it'll be interesting to follow the data in the future. Other than that, stay safe and take care. And remember, go birds.